Hi, my name is Hazel.
And I'm Clarissa and what we did for our disease project was gonorrhea. Gonorrhea is actually the second most infectious STD in the United States. Every year there's over 300,000 cases reported, and the ages of people that usually get infected with gonorrhea is between 18 to 24. And in 2008, girls between 15 and 19 actually had the most cases reported in the United States. Gonorrhea is caused by the bacteria Neisseria gonorrhoeae. I think that's how it's pronounced. This bacteria is in the oral pharyngeal area, the eyes, the rectum, the urethra, opening of the cervix.
So the signs and symptoms of gonorrhea in men are burning sensation when they urinate, white, yellow, or green discharge from the penis, and painful or swollen testicles. In women, they also have a burning sensation while urinating, yellow or bloody discharge from the vagina, bleeding between menstrual periods, and pain during sex. In women, most of these signs and symptoms do not occur until after 10 days, but also many women do not get any signs or symptoms at all. Like most STDs, gonorrhea is preventable, and the most effective way to prevent getting gonorrhea is by practicing abstinence. You could also speak to your partner about gonorrhea, so you could lessen the chance of spreading it to your partner. And you could also limit the amount of sexual partners that you have. Another way is to use a condom
during every sexual activity, and also seeing your doctor just so you know if you have gonorrhea or not, and to prevent it from spreading it to someone without knowing, basically. If you do have gonorrhea, basically it could be treated with antibiotics. There's been a rise in fluoroquinolones, I don't know if we're saying that right, resistant Neisseria gonorrhoeae. So basically, this disease, the bacteria is becoming antibiotic resistant. If you do have gonorrhea, the first thing that your doctor would prescribe is cephalosporins. If these antibiotics are not effective, your doctor can prescribe others, but usually that's the first thing they'll go to, is to prescribe you some type of cephalosporin. It's also important to take the medication that your doctor prescribes you, just because if you don't, obviously you're not going to get rid of it, but if you don't take it as prescribed, you can get the symptoms will disappear, but the infection won't, so you'll still be suffering from gonorrhea. It's just you won't have the symptoms, and it could lead to a lot of other serious matters, like getting a pelvic inflammatory disease, becoming infertile, and stuff like that. So gonorrhea is something to be aware about. Like we said earlier, in the United States alone, there are over 300,000 cases reported every year, and that's not including the people who don't know they have gonorrhea or not reporting their cases to their doctor. Basically, the best thing you could do is practice safe sex. Don't have sex at all. Get tested, because you want to know if you have gonorrhea, and if you do find out that you have gonorrhea, you want to get treated for it as soon as possible before it leads to anything more serious, like pelvic inflammatory disease, being infertile, and it can also affect other parts of your body, like your joints and stuff like that. So that is our presentation on gonorrhea. I'm Clarissa.
And I'm Hazel.
And
thank you.
Bye.
Bye.